Hello everyone and welcome to the 15th episode of the Adventures of Brain Injury podcast. I'm Cavin Balaster, severe traumatic brain injury survivor and creator of adventuresinbraininjury.com. Alec is currently on hiatus, but we have a very special guest today. This is Michelle Malmberg. She is an acquired brain injury survivor, actually of two acquired brain injuries that occurred 4 years apart. And we're going to be talking about the first one in this episode, which is when a large tumor was found in her right frontal lobe. The second acquired brain injury is actually a neurological autoimmune condition that is pretty much a medical mystery at this point, and we're going to be watching this as it unfolds. So, without further ado, let's jump into it. How you doing, Michelle?
Hello from Canada, Cavin.
Hello, Canada. Where in Canada are you?
Calgary, Alberta, Canada.
Yes. And that's not central Canada. That's considered Western Canada.
Your geography is excellent.
I'm learning from the best. So on November 28th, 2010, that was a big day. What happened?
Very early in the morning, I had suffered a grand mal seizure, and I was lying in bed with my 3-year-old son. And my son began crying and screaming, and my girlfriend and her son were staying overnight with us. They had just happened to make arrangements to come and visit us the day before. And I had picked them up at the airport. I have no recollection of picking them up at the airport. I have no recollection of driving them home to my house, save for the fact my girlfriend reminded me that I nearly sideswiped a semi-trailer truck on the freeway. So we made it home. I made supper. Again, no recollection of having made supper. My girlfriend said, "You look very tired." So this is the day before. This is the Saturday, November 28th. And my girlfriend said, "Go to bed. I'll take care of the boys, and I'll see you in the morning." So that morning came very, very early for her when my son was crying and screaming. And she got up to take care of him because there was no response from me. She went into his room and found me in his bed. He had a large queen-size bed, and I was sprawled out, vomit all through my hair, and was non-responsive.
How old was your son?
He was 3.5 years at that time. Yeah,
wow.
So a little man, and clearly unable to communicate that his mother was in distress, unconscious, in fact. So my girlfriend, her name is Jane, and she works as a flight attendant for an airline here in Canada, and is trained every year and tested every year for flight safety and emergency procedures. She's never, ever, ever had to use her skills in the air. She had to use them that night on land. Mm-hmm. So she scooped up my boy and tucked him into bed with her son, and then proceeded to call the ambulance. She said it took forever for help to arrive. It was very early in the morning, so fortunately the streets were quiet. She said there weren't any lights. They just approached very quietly, 2 or 3 o'clock in the morning, and very calmly came up to the front door, and she left all the lights on and the doors open so they could just come in, and they proceeded up the stairs into the bedroom, and they began attending to the situation at hand. And it was very clear that I'd had a grand mal seizure. And unbeknownst to my girlfriend or I'd been having petit mal seizures that entire day. And I guess just to note, the day before that, I'd had a very mild headache. That afternoon, I was shoveling snow with my boy. We have a very steep driveway and a fairly wide sidewalk in front of our property. And we'd shoveled that, and very uncharacteristic for me, I'd had this very dull ache in the right side of my head. So that was the Friday, then the Saturday, and then the Sunday morning, early in the morning, was the grand mal seizure with the vomit and the non-responsive nature. And so when the paramedics arrived, they put in a line into one of my veins in my arm to deliver some anti-seizure medications. And we didn't find out for many, many hours later that line was placed interstitial versus intravenous. So all of the anti-seizure medication was going into my muscle tissue and wasn't being delivered into the bloodstream to stop the seizures. So I was continuing to seize all the way up to the hospital. I was taken to the neurological hospital here in Calgary. It's called the Foothills Medical Center. And when a patient arrives unconscious at the neuro hospital, they always scan. And that's when they found out I was dealing with a massive brain tumor.
Wow. Let me recap that. Your friend is staying with you. I mean, this is a friend you hadn't seen for a while. And you told her, or she actually told you, you look tired, you should go to bed, right?
Yes.
And so you went to bed early, and she found you in your son's bed, convulsing, and your son was screaming, and she put you on your side and called the paramedics, and they came and took you out of there. They went to put some anti-seizure medication in you, but they missed your vein. And so you weren't getting that anti-seizure medication, and so you continued to have seizures.
Yes, that's right. So the grand mal...
When you got to the hospital, because you were unconscious, it's routine to give an unconscious patient a cranial scan.
Correct.
And what did they find?
They found a very large tumor in my right frontal lobe. So large, in fact, it was pressing across my midline, the midline of my brain, and pressing into the left frontal lobe.
Wow. And at this point, you're unconscious, right? You're in a coma.
Yes.
What was your score on the GCS?
Yes, that infamous Glasgow consciousness scale, or Glasgow coma scale. So I hit rock bottom. I was a 3 out of 15. And 3 is the lowest and 15 is the highest. We're 15 right now, Cavin.
We're 15. Yeah.
We are.
It's funny. It's funny you say rock bottom, because what I say is that if a rock had a heartbeat, it would have a GCS 3.
That was me. I was stone cold. Yes.
That was me too for a time.
Yes.
So it showed that you had a large tumor in your right frontal cortex. And I've seen those MRI scans, and it's a huge tumor. Like it's your entire prefrontal cortex. It's massive. What do you think? The size of your fist, maybe?
Yes, the neurosurgeon told me that it was the size of a large mandarin orange. So
bigger.
Yeah, it was a bit disturbing because I don't have a large cranium. So for me to look at a piece of fruit and think, wow, that was inside my head, with all the rest of what ought to be inside my head, I didn't know. I couldn't conceive of how that was possible and how it could have grown so large without any symptoms. Because before that, I had a very active life. I traveled and danced and worked in film choreography and stage choreography and ballroom dancing, Latin dancing. And I traveled globally and studied. I turned to nutrition studies when my son was young. So I was a very active, engaged individual, and always reading and learning. And really, there wasn't any indication at all that there was an issue. So it truly came out of left field. It surprised everyone. And as people found out what was happening, they were they were stunned and shocked, because what? Physically active, in shape, organic, eating home-cooked meals. Michelle, she's what? In hospital with a brain tumor and with a severe prognosis. It was just so unexpected.
Wow. So do you think, you were into healthy eating and traditional foods prior to this incident, and that may have sort of masked the symptoms of this brain tumor.
I think you're right, Cavin. I always said that that the good nutrition really made my body so capable of functioning, even when there were massive changes going on in my brain, that the nutrition helped my body in many other ways. There weren't any lab markers that were out of range. There wasn't anything on typical lab testing or clinical observations that drew anybody's attention. I think probably the most diagnostic, if we can step away from your food comment for just a moment, looking back, it was one of my dance students, a young gent, and when you're ballroom dancing, you're in front of one another, and was probably very diagnostic as I review any and all events prior to this grand mal seizure and discovery of this brain tumor. I was dancing with this young man in a brightly lit studio, sunshine and as well as indoor light. So his comment to me was, "That's really freaky." I said, "Well, what's freaky?" He said, "Your eyes, one pupil is smaller than the other." And of course, with all the bright light in the studio, the pupils should have been tiny. So this young gentleman was freaking out that my pupils were bizarre, and one was dilated and one was constricted. And he thought it was very uncomfortable for him to look at. And I had already been to an ophthalmologist years prior, and nobody ever caught that.
So you have a GCS of 3, and they do a cranial scan that shows that you have a pretty large tumor in there. Now what do they do?
So the intention was to operate immediately, do emergency neurosurgery and remove the tumor, but the medical staff were having difficulty stabilizing my body, and so to resolve the continuing petit mal seizures, they were trying to find a line or a vein to put in a line, and they couldn't. They tried the tops of my hands, they tried wrists, the crooks of the elbows, the top of the feet, and so their last resort was to insert a central line through the neck, which would go straight to the heart and provide medications and any other inputs as quickly and as efficiently as possible. But there was an error made when they put the central line in. It punctured my right carotid artery. So I began bleeding internally. The bleeding, my vital signs kept dropping and dropping. My blood pressure was dropping to critical levels. And so I was rushed for a chest x-ray, which revealed that the central line had indeed punctured the carotid artery, and I was bleeding out internally.
My God. So they
Yeah.
punctured your carotid artery.
Oops.
And you're oops. And you're bleeding out, filling your thoracic cavity with blood.
Correct. Yes.
So all right. So what they do from there?
From there, they performed emergency thoracic surgery to drain the blood off of my internal organs. If it's left there, it can calcify. Of course, calcified tissue doesn't work as well. So my heart and my lungs and my other organs, of course, were at risk. So the blood was drained off of my chest. I was given 3 units of blood in a blood transfusion. There was no way around that. I had to have the transfusion. Mm-hmm. And it was also discovered that my right lung was showing a hemopneumothorax. So it had also been affected by the blood, the internal bleeding. So it was
hemopneumothorax.
Hemopneumothorax. So
hemopneumothorax.
Yes.
That's going to be my buddy's next thrash metal band. That's it.
We listen to different music.
All right. By the way, I'm making jokes here.
Please, yes, do that. Please.
I know this is life or death, and it's incredible that I'm speaking to you right now. I mean, you're bleeding out into your thorax. You have a hemopneumothorax. Hemopneumo. Is that right?
Yes. Well, it's.
I'm gonna have to introduce him to this band name.
Yes. So it's there are combinations of it, but essentially it describes 2 conditions where there's air in the chest cavity as well as blood in the chest cavity. So usually that happens if there's been a puncture through the chest. But of course, I'd had the emergency thoracic surgery, so I had a chest puncture. I had 2 incisions made between my ribs on my right side and large tubes inserted to drain the blood out of the thoracic cavity. So yes, so I was bleeding internally, and they were unable to perform neurosurgery. Instead, I got I had to have the thoracic surgery.
Mm-hmm. What was your chance of survival at that point?
It was pretty low, Cavin. My husband was told to come quickly but drive safely, because my survival estimate was 1%. Wow. So family was called in. My husband was called, and everybody was waiting, and everybody was hoping he would arrive. 3 hours he was out of town. 3 hours out of town, driving on a major roadway through a prairie blizzard at 3:00 in the morning. So it was one of those situations where you think it only happens in Hollywood. It's only in a drama that you get this type of call, but it happened to be our real life scenario.
Or a Stephen King book.
Or a Stephen King book, yes. Yes, absolutely.
Wow. So right now they're stabilizing your body, and draining the blood from your thoracic cavity while they're giving you a transfusion of blood as
Correct.
well.
Yes.
And meanwhile, you have a tumor the size of a large mandarin orange in your right frontal lobe.
Yeah.
So, how do you feel about mandarin oranges these days? I know you're a foodie. And I would consider that a traditional food.
A seasonal food, yes.
Sorry. Yeah. Anyways.
No,
It's just a big goober, right?
It's just a big goober. I actually had never had issue with mandarin oranges, not for the past 6 years, but now that you mention it, this Christmas might be a bit different.
No, I don't want to implant anything in your mind. There's nothing wrong with mandarin oranges.
They're delicious. Yeah.
They are delicious. Okay, all right. So while they're stabilizing your body, they can't perform the neurosurgery.
That's correct. So the team, they were on call, ready to go, and they postponed the surgery for 10 days. So I was in the emergency room, I was transferred to the intensive care unit, and then finally, about 5 days in, 6 days in, I was transferred to the neurology ward at the top floor of our medical center. Best view, best beds.
On top of the world.
On top of the world. Now, of course, I wasn't conscious. I couldn't enjoy it, but it was kind of like having a corner office, I think.
Something like that. Something like that.
The penthouse.
Yeah. And you have like servants taking care of you. Yeah. Yeah.
So the most important one who came to visit me was the neurosurgeon who very succinctly said to me in one of my 2 moments of consciousness, "Michelle, my name is Dr. Wong. You have a brain tumor. We are going to operate on Monday." And then I was out again.
Right.
Yes.
Wow.
So.
Okay, so and then they Monday came around. You don't have many memories in between.
I don't have many memories at all. By the time I got to the neuro ward, I was able to eat, and so my family was bringing smoothies to me, and my 3-year-old son was feeding me. I have no recollection of these events.
Well, that's nice. I couldn't eat for months.
Yes,
they couldn't bring me food. I had to have friends smuggling it in.
Well done.
Yeah, sort of.
Yes.
I wouldn't recommend it.
But I think it highlights, Cavin, how different each of our journeys are when we read and talk to other brain injury patients. It's incredible, really, how many stories there are.
Yeah, absolutely.
What people have gone through, what they've endured, and what they've persevered through to come out to the other side. And some are not as lucky as we are. So it's I think it really highlights the fact that it's a long road and oftentimes a struggle, but
that's absolutely true. And I think what really ties me and you together is we both went through some very traumatic neuro events, and what I love about you is your outlook on life.
Thank you.
You know, following it, and I really just we get along very well because of that, and like there's some chemistry as far as like where our outlook is after such traumatic event. I mean, they clearly have changed us.
Yeah.
But you know, changed our interests, our appreciation of life. There's a lot of things that came of it, and I really love where you are with your mindset afterward, and I can relate to it.
And that's one of the things that I really enjoyed speaking to you about, and also realizing that the road to getting to where we are now was pretty long and pretty bumpy, and at times dark. And there were very few people along the way who actually understood what it was like to make that journey. And so there were two people, interestingly enough, in the journey through my first brain injury, who really understood, and you're one of them. The other one I do want to mention because she was a very dear, sweet mother to a friend of mine, and she ended up becoming a dear friend of mine as well. Her name is Marg Kenny, and she was in a very severe car accident, and she struggled to recover, struggled for years, and she confided to one of her daughters, it would have been so much simpler if I'd died. And when my girlfriend Andrea told me that story about her own mother's journey, I was uplifted because it was the first time somebody had ever put words to how I was feeling, that this was so hard and that I was such a burden on so many people that it would have been much easier if I had slipped away from that 1% and I had died. So to come back and then to connect with you and then start to grow my little community of other brain injury patients, it has really given me some appreciation, perspective, and completely changed my outlook, because when you realize you're not alone on this journey, the sun starts to get a little brighter each and every day. And you and I being online, connecting with other brain injury survivors through the online forums, I mean, we can see where other people are on their journeys, and some of them are on that path still struggling. Mm-hmm. And it's interesting to read their stories and their updates and know that, wow, I recognize where they are. I've been there. Mm-hmm. It's really powerful. It's really powerful for me to realize how far I've come. And it's really powerful to be able to contribute to someone with a few words across the miles, across the cyberspace, and mm-hmm. To be able to uplift and give them hope.
Yeah. Actually, how did we met? You began to get very interested in functional neurology.
Yes, well, and that was new to me. When I was studying nutrition, I had come across functional medicine, and what I had read and began to understand was that this was the future of medicine, and I wanted to study this from a nutrition perspective and incorporate that into my future work. So I was really keen to start studying functional medicine and functional nutrition. Little did I know that there was a functional neurology specialty until a book came out called Why Isn't My Brain Working?
Dr. Dati Skarazian.
Yes.
Yeah. And I was actually a case study in that book.
That's right.
And so what happened? How'd you find me?
Well, how did I find you? I after I had read about after I'd read through the book Why Isn't My Brain Working and started looking up more information about functional neurology, I came across your your Kickstarter campaign on Dr. Karazian's website, and so I started putting the two pieces together. Wait a minute, this Cavin and this Colin, this is the same person, and you were actually the first person I reached out to because I thought you would probably understand what I've been through.
And that's when I told you, because you didn't make the connection that you had a brain injury.
Exactly.
Yeah, it's interesting because brain surgery that's an injury for sure, and on top of it, the I guess acquired at that point. And your story goes deeper than this, like much deeper. We had to break this up into 2 sections because of how deep it goes and where we are now. Yes. With everything. And I want to bring it back to what you were saying about survivors that are at a place on their path where they're not quite at the accepting phase or something of that sort. And the fact is, it ebbs and flows for me. Like, yes. I'm not always, happy with everything, and it's not always great,
Yes, I know.
But I'm sure you can relate with that as well.
Yes. Go on.
No, I'm done.
Well, it was a very, very long journey for me because, as I mentioned, the surgeon told me that it was routine neurosurgery. Everything went very well. After the surgery, I was released from the hospital. I had, not surprisingly, I had anemia, and it didn't resolve for a couple of years. So I was fatigued and recovering from neurosurgery with a very, very low iron count. Everybody around me was just so happy that I could wiggle my fingers and my toes and that I was talking. It appeared that I had come through and was okay. I had, some friends who said I was a Christmas miracle, and I was home on December 13th. So really, I was, 14 days in the hospital, had 2 major surgeries, and then sent home with a whack load of anti-seizure medications. I was on valproic acid and Dilantin, and those medications on top of the surgery, on top of the fatigue, on top of the iron loss, I was just, I was unable to really focus. My sleep was disrupted. I was eating all sorts of strange combinations of things, banana muffins and sauerkraut at the same time at 3:00 in the morning. And it was just, I was really in a very strange space. And when I think back to those days, taking the medications, I hadn't ever taken drugs. I never even took cough medicine, even as a child or a teenager. I never took medications like that. So to take these drugs that I was prescribed and told I had to take was, it really weighed heavily on me. And of course, as we know, my eating was so clean that I didn't want to be putting these toxins into my body.
Blueberry muffins and sauerkraut. I can relate with that, by the way. Like, I would be up at 3 a.m. cooking up some like bacon and I don't know, something. But I remember my mom and her husband waking up and being like, what are you doing at 3 a.m. cooking bacon? Come on now.
You needed to turn on the fan and put that beautiful aroma outside. Yes. No, it just, when there's a head injury, a brain injury, it really makes for a lot of changes. And I think sleep is one of the most common disruptions that people find. And the hunger levels, hunger is not on its regular schedule. If you even notice hunger signals at all, it's as the brain is recovering, there are so many oddities that arise. My hair started falling out from from who knows what. I kept thinking, these drugs, and I had sensory issues develop. I could feel the hair falling out and, feel it on my back, on my arms, and I had developed just this concern for all my hair falling out. And I could see it on the floor in the kitchen, and I would be vacuuming twice a day just to get the hair up because I didn't like to see it on the floor. And it got thinner and thinner. I couldn't tie my hair back with my barrettes or my elastics. It was very unnerving to have all these changes going through my body. And yet I knew that there was something not right, but everybody kept saying to me, oh, you're fine, you're great. And I never got that peppy feeling back. I never really recovered as well as everybody was telling me I was. And my sleep wasn't returning to normal. My fatigue levels were not resolving. My fatigue was not resolving. My energy levels were not coming up. And I kept dragging on and on and on. And it went not just, I was given a time frame of 6 months. Well, after 6 months, why don't you go back to doing some of your studying and, make plans for doing your lectures, but give yourself a good 6 months to recover. And I was forbidden from driving for those 6 months. And so it just kind of seemed like, if I just waited and I did as I was told, then I would feel better at the end of that 6 months. But for me, things just kept going downhill. And I had a friend of mine, one of my dance professors from university, she sent her nanny over to help us. Her daughter had grown, but this beautiful Greek woman was still in her life, and she sent her over with one instruction. Michelle has no idea how important it is that she does not get tired. And nobody in the hospital, and nobody, there was no care after I was discharged. But not one person had said to me, you're going to be really tired and you're going to need regular naps. You're going to need to take it easy. And heaven's sakes, the week after I got home from neurosurgery, I was out shoveling the driveway and the sidewalk. But I couldn't do it.
And vacuuming up your hair that was falling out.
Vacuuming up my hair.
I'm thinking about how fatigued you are and how you're still pushing through all these activities.
Well, yes. I had no idea.
I can relate to that.
Well, and I think we all want everything to just be better and go back to normal. And I didn't realize at that time what kind of a life-changing journey I was embarking on. It was just a rush to get everything back to normal so that I knew where I was, and I had my goals and my 5-year plan on track, and that I wasn't a burden on anyone. And of course, let's face it, people are around and they can help for a short time, and they did. But when you're not looking like a chronic case or a chronic convalescent, then everybody just carries on. And I certainly was planning on carrying on. I had big plans for my nutrition work, and Cavin, it was the longest, most tiring, exhausting recovery period. And it became a never-ending recovery period. So I started searching out other options. I drove a number of hours to another city to have a medical doctor who practices Chinese acupuncture realign my chi. And I thought, well, that's it. That's going to do it. That'll be terrific, and I'll feel better. I'm sure it was helpful, but it didn't resolve my issues. That was one step. I took that first year, and again, things were just dragging on. And so by the time I got through my first year of recovery, I was starting to, I was starting to push myself again and thinking, well, this is it. I just need a goal. So I set myself up to take the GAPS practitioner training, certification training, and I flew down to Texas to do that. And I was just thinking I needed some goals. I need to just get things into place and push through. And I think it was great to get out of the house and go and start working toward my dreams, but it was exhausting on my body. So mentally, it was a good endeavor, but physically, it was absolutely exhausting. I asked again for help the next year, and I ended up going to an acupuncturist trained by the doctor I had seen initially. And to my good fortune, she had years of service at the neurological hospital I had been discharged from. And she said, why were you not put through the brain injury clinic or Unit 58, which is the post-operative care and brain injury ward? And I said, well, I have no idea. She said, well, I can't believe that would have been overlooked. And so I told her more of my story, and she stopped and she looked at me and she said, your problem is you look too good. You would have done better with a little drool or a limp. And I cried. I absolutely cried because I had been asking for help, but she hit the nail on the head. I didn't look like I needed help. And so she made a referral for me to a community rehab program. And then she also wrote a letter of recommendation to a doctor whom I had found, because I didn't have a regular doctor. I was a healthy 40-year-old. I just didn't have a regular physician I was seeing. And so she knew of a doctor and asked him to make a referral to a brain injury clinic up at the neuro hospital.
So when was this?
This was this was 1 year after.
Okay.
1.5 years after my my neurosurgery. And so I did get into the neuro rehab program, and I met a social worker who was amazing. It was the first time I felt like I had been listened to in the 1.5 years of my journey. And of course, things are very stressful when you're trying to raise a young child and manage a house. And my husband's working full time, and his job required travel. So I was often on my own managing the house and meals and a young child and preschool. And of course, I'm trying to sleep, and my little boy isn't always sleeping on my schedule, which is already intermittent. And I wasn't getting enough sleep to be able to function normally. So I was putting in as much effort as I could to start going to this brain injury rehab. And it was during my nap times, during his preschool times. And it was the worst time of my day. It was in the afternoons. I started seeing an occupational therapist who, it was, Cavin, just to think back to the treatment I was given by people who were to specialize in these neurological recovery programs. She didn't understand at all the fatigue, and she wanted to know what my issues were. I said I had a really difficult time putting meals together and thinking about what to cook and how to plan ahead. And I could barely work a few hours in advance, let alone a few days in advance. And so her solution was to give me a menu plan. And I just needed to fill that out for the week, and then I would have the answers, and I would just have to follow the plan. And I realized how disconnected she was from where I was by the fact that she didn't understand I couldn't work hours in advance, and that it was very difficult for me to do handwriting. So for me to fill out a whole sheet on what I'm going to make for the week and how I might get groceries and who might actually chop the vegetables, because that all took energy and I didn't have any energy.
What I'd really like to ask you about is, you started getting into functional neurology, and you telling me all of these symptoms that I'm not observing very much, from my end. Then again, you also look too good, right?
Yeah.
So what has resolved, and how has it resolved?
So functional neurology, yes, I had discovered this specialty through the Why Isn't My Brain Working book, and two of my girlfriends and colleagues, they had been following the author, Datis Karazian. And one of my girlfriends was in the United States, in California, and she had taken many lectures with Dr. Karazian. And so she said, yes, you've got to get this book and follow this work. So I jumped on the website right away and put in a query to the clinic, and I ordered the books and was delighted to receive them and started diving in. I couldn't believe that within the first few pages of the first chapter that so many of my questions had been answered that my neurosurgeon and my doctor were unable to answer. They were answered within the first few pages of this book. I just knew that there was an answer here for me if I was to continue. So I went through the book and I applied as much as I could, and I sent a request to the clinic to meet with this doctor. I had read the dedication for the book, and I was completely overwhelmed by how sincere it was and the humility that this doctor had. And I was just convinced that there were answers that would help me with my case. So I sent a query to the clinic to meet with the doctor or to follow some advice from their clinic. And
I want to read that.
Oh, it's beautiful. First,
do you have it?
Yes, let me read it to you. First, I would like to dedicate this book to my wife, Andrea, and to my daughter, Maisie, for their continued support and the sacrifices they have endured. Developing, writing, and teaching this information has meant many days and nights locked up in my home office writing and researching, countless hours in airports and hotels during trips all over the world, and many late nights at the office working with patients. Second, I would like to dedicate this book to the millions of patients who have been ignored and overlooked when suffering from a head injury, brain dysfunction, or brain degeneration. Nobody understands the difficulty you face as you appear normal to those around you. I underlined that.
There it is.
Third,
Yeah.
I would like to dedicate this book to all the healthcare practitioners who are reading this book because they want to better serve their patients. The world needs more caring and passionate doctors like you.
Amen to that.
Amen. And I thought that revealed so much about what kind of a person the author might be.
Yeah.
And yeah. And I was right because I got to meet him.
He's pretty incredible. Yeah, I've not met him in person yet, but yes, very, very amazing author. And so, seeing Dr. Karazian, is that the only functional neurologist you've seen?
Yes. So my first brain injury, I was fortunate enough to be accepted by his clinic. I just asked that they give me some guidance and tell me where to go. But after they heard, they heard my story, his assistant, Sandra, said, I have no idea where to refer you. We'll take on your case, make up an application, or make up a case review, and the doctor will review it and see if he'll accept your case. And so it was a very nerve-wracking couple of months as I put together my case review for him. It ended up being 44 pages. I started from pre-birth until the day I posted it. And
it's a book in itself, huh?
Well, I considered it my postgraduate thesis. So it was actually a very therapeutic process to go through, and of course I had no idea who was going to be reading this and who my audience was. So I just wrote. I just wrote like I was writing in a diary, and I let out a lot of emotion. There were the ups and downs through my whole life, as well as the neurosurgery and the 3 years of recovery that really hadn't resulted in any recovery. So it was very therapeutic to even just get to that point, the process of purging pent-up emotion and frustrations. It was a good process. And then fortunately...
Yeah, absolutely. Super cathartic.
Very good word. Thank you. Yes, that's it. So I had, I had a telephone interview with Dr. Karazian. He said that he felt his work would be useful for my case, and that I could go ahead and make arrangements to book an appointment, have an assessment, and we would go from there. So a couple of weeks after that, I went to California and did unfortunately very well on so many of his tests. I started to become worried that he wasn't going to be able to help me. And it was the last test that he did. It's the Optokinetic assessment and how the eyes move.
Mm-hmm.
And that provided a clue as to which part of the brain was not functioning optimally. So on the very last test, after a number of hours in the clinic, we finally got an answer as to what part of my brain was not as strong as it could be.
Yeah, for me, Dr. Culleton strapped what's called videonystagmography.
Yes.
They're goggles that videotape your eyes, and he had that on me while I would spin in a chair, and so it would test the vestibular. And did you do the same thing?
Yes, I did. I thought, what kind of a test is this? I thought it was a bit of a trip, to be in a completely dark goggle, having no sense of what was around, and then having this doctor spin me in a chair.
Right.
I have to say, I was a little bit suspicious. Well, of course, because there are cameras inside the goggles. Yes.
And completely hooked up to your vestibular system. So was that the test that gave clues?
Yes.
Yeah. Okay, well, this, we could go on for a long time. I'm sure you have a lot to say about nutrition and dietary practices that helped you. And I'm very interested in it as well. We have a lot to talk about. So in the next episode, we'll talk about your second brain injury, which is actually an autoimmune brain disease that is a medical mystery, misdiagnosed many times. That's going to be very interesting. Mm-hmm. And I'm looking forward to talking to you about that, and kind of seeing how that unfolds as time goes on.
Yes, definitely. I look forward to sharing that with you.
Yeah. I'm really looking forward to it, Michelle.
Thank you, Cavin.
Why don't we sign this off? Thank you guys so much for joining us for the 15th episode of the Adventures in Brain Injury podcast. We will see you guys soon. Take care.
Bye.
Ciao.
And if I choke, someone take me to a doctor. then take me to a nurse. Someone take me to a doctor, then take me to a church. Someone take me to a doctor, just take away this curse. Someone take me to a doctor. Someone take me to the